Hello and welcome. I'm sure by now you have heard of the drug Ozempic. Most of you, those who are overweight or fat, I'm sure you have heard about this drug Ozempic. Ozempic is a drug that is given transdermally. It's a brand name of a drug known as semaglutide. Here is what you need to know about the drug semaglutide, famously known as Ozempic. Semaglutide is a glucagon-like peptide 1 receptor agonist. It mimics the natural hormone incretin. This hormone enhances insulin secretion, reducing glucagon and slowing the gastric emptying. The semaglutide drug is usually indicated for number 1, type 2 diabetes. Type 2 diabetes, it improves sugar control in your body. The second use is in weight loss, and the third use, it reduces cardiovascular risk in diabetic patients, more so patients with type 2 diabetics. Side effects of the drug. The drug causes nausea, vomiting, diarrhea, constipation, bloating, and risk of pancreatitis. People who should not use the Ozempic injection. Number 1, people with type 1 diabetes. Those are people with insulin dependent diabetes. Yani watu wenye lazima wadungwe insulin. History of medullary or thyroid carcinoma. So for example, in your family, you had somebody with a cancer of thyroid. It's usually a rare cancer, but for example, in your family, ukiangalia kwa history yenu, there was somebody who had the thyroid cancer. So you should not use this drug. Multiple endocrine neoplastic syndrome. You should also not use this drug. The third one is when you are pregnant and you are breastfeeding, or you are pregnant or breastfeeding. People with severe diseases of the gastrointestinal, more so gastroparesis. Okay. Then the fourth one is obviously when you are allergic to semaglutide. Then the last one is when you have history of pancreatitis, because we said in the side effects that we may have risk of pancreatitis, inflammation of the pancreas. Ozempic helps you lose weight through 3 main mechanisms. The first one is appetite suppression. It acts on the GLP-1 receptors in the brain, especially on the hypothalamus, to reduce appetite. It increases satiety, feeling full, so you will eat less. It slows gastric emptying. It delays how fast food moves or leaves your stomach, keeping you full for longer, reducing food intake. It improves insulin sensitivity by controlling blood sugar levels and reducing insulin resistance by that. It lowers fat storage and promotes better metabolism. The result is usually fewer cravings, smaller portioning, and calorie deficit. Best results are obtained when you combine with healthy eating and regular exercise. So before you go and use the Ozempic injection, make sure you go for proper checkup and you are advised accordingly